Good day, dear visitors, good day, dear colleagues and dental students. My name is Alexander and I welcome you on our Rubberdamology YouTube channel. Today we continue to record for you our exercises to self-learning and training skills on rubber dam isolation in mouth cavity of your patients during your dental clinical work. And the previous lesson we discussed how to isolate the group of tooth on the lower jaw from premolar to premolar with the incisors using two types of clamps. The using clamp with wings, clamp number 2 from company Tor VM. Today we continue this working plane and discuss how to use wingless clamp number WV2, also from the same company. As the rubber dam plate are using Nicton rubber dam plates, thin, very good material for your clinical everyday work. Let's start. I must to say you that every rubber dam plate have two sides. One is for patient side, it's glossy, and one for clinical application side. This is more comfortable for work without shining dots. Fix this rubber dam to your frame. It's very important to fix this rubber dam properly, not such way. This is a very big mistake to fix this type. The rubber dam frame must be above your rubber dam plate, such way. You must check that you have equal dimension of free margin from the left and right side and very small amount of rubber dam at the top. When you are starting to mark your perforations for lower jaw, you did not make them upper than this lower part of your space of the rubber dam inside the frame. For the upper jaw, we did not make perforation upper than this part. For the lower jaw, not upper than this quadrant. Very easy. We're starting to make perforation. The strategy for making perforations for rubber dam I discuss you specially in the separate lection. For incisors of the lower jaw, we use smaller size of your puncture. And today we are using the puncher from Sanctuary Dental. It's a very good instrument. And we're starting, I think it's more comfortable for you to working from the bottom side of your frame, from the center, symmetrically to the right and left for one tooth. Start from lower central incisors. Left, from the 5 mm to the right. Right central incisors from this tooth, also plus 5 mm. Lateral right incisor from the left side, plus 5 mm. Left lateral incisor, increase the diameter for your hole for one position and continue to work. What you can receive when you're working from the bottom side of the frame. Very funny situation. You have double perforation because your rubber dam can move to the inner side and you punch them also. I think for me, for our exercise today, this is not very big mistake. Also, I think for clinical use, this is also not a problem, but this is not very good for your general strategy for work. So you can solve this issue to working always from the top of your frame and continue to make perforations for what? For canines. Right, left, and made for premolars. And from the right side, the same. Previous lection we use clamp with wings. Today we're using clamp without wings. Open these two real packs. First of all, we need two tests for our successful clinical application of rubber dam. First of all, interdental contacts of your tooth that you select to isolate with rubber dam. Check every contact that you can understand that it's enough free for work with the flows. The second test is the clamp stability test. Fix your clamp in your clamp pillars. Slightly fix the stopper and apply your clamp to the tooth very, very gently and carefully above the gingival margin. I show it to you. This is good. You can place your clamp in any position, but it must be stable. This is not good for you. This is also, I think, very aggressive to gingival margin, and some about 1 millimeter above the free gingival margin is the optimal. Also check position at the lingual side. Then repeat these tests for the right side of your patient. Apply the same clamp to the tooth number 45. Then slightly press to the arcs of the clamp that it stays stable. We have two strategies. One of them is stretch rubber dam over the arc inside mouse. Maybe it's fast. It's very fast method. Let's start to use this for the starting. And then we try to test another. If your puncture is good and have a nice quality, you cut very clear holes without damage your latex plate, and your latex will stretch perfectly. So you can stretch it over the arc without any problems. It's very easy and very fast, especially when you use Nixton rubber dam plates. Maybe it's more comfortable to you to detach this frame from the rubber dam. Then repeat fixation of rubber dam to the arc of the right clamp in mouth of your patient. It's ready. When you have two clamps, it's no problem to decide which angle of the rubber dam is right and which is left. And then you can attach them back to the frame. And then you must straighten rubber dam plate over the clamp wings, or if you work with clamp without wings, to their body. And don't forget to close with the rubber dam tooth number 46, 36 from the both sides. Then distribute equally your perforations over the tooth. And continue to invert your rubber dam plate into interdental space with the floss. Remove your floss laterally or bend it to 180 degrees and remove it laterally. Which you like better, which is more comfortable for your patients in this clinical situation. Pay attention to distribute your rubber dam holes correctly to all tooths, and did not invert two perforations in one interdental space. This is error. Work systemically from the one side to the other side. Don't make your work chaotically from different sides. It's not help you, you just waste your time. I replace my floss to a new one and continue an inversion. Sometimes it's very easy to stretch your rubber dam with the hands, with your fingers, and insert in a dental space. With the Nicton it's very fast, it's very good. But be careful, don't damage your rubber dam. All tips about inversion of rubber dam around your tooth, your clinical crowns, you can watch in my previous lesson about using wings clamps number 2 in the same position. I show you only one inversion from tooth 41. It's very fast. Use your floss, insert with different sides, hold your floss with the probe from the lingual side. Let's look what we have inside. Hold it with the floss, with the probe, and then move your hands. That's all. Very good inversion. This is one way of applying rubber dam with clamps without wings. As always, we finish our exercises. I advise you to make these envelopes. It's very comfortable with works. It's very compact. So invert free margin inside, small turns down, and apply the free angle of your rubber dam plate to the top left corner of your frame. Hold it with your fingers from the right hand and then tense and cover with the inner part of rubber dam. Your assistant can repeat it symmetrically from the other side. So we cover our errors with perforations outside, so we did not even see it during our clinical work. But always remember to cut your perforations from the upper part of your free side of frame, from the open side. Very good. Start to detach these clamps and make the next variant. How to remove rubber dam from your patient. We have different strategies. You can carefully work with your hands. Don't make such way. One hand and crush it out. This is error. You have salva on over surface in your room, but very gently hold it with fingers and remove. I started from the right side. It's worked good. But if you have scissors, you can cut also very fast and very clean, and then remove your rubber dam out very easy. After you remove your rubber dam, check also interdental spaces or watch at your rubber dam plate and decide, is this all parts removed or you stay something in interdental spaces. Clean it and remove all parts, because you made gingivitis to your patient. The next variant. We take the new rubber dam plate decide which side we put outside and which part is inner. Fix to your frame. I hope you made it very fast. We record 10 lections about this, and I don't stay on every aspect. Watch our first lections, how to put your fingers, how to divide the surface of this rubber dam between frame. As we see in previous variant, we can receive errors to making perforations from the bottom of your frame. So we start to work at the upper part of our frame, and we made all perforations not higher than this line. Hold it line in your mind. Choose the small perforation hole in your puncture and continue to work. Central incisors. 2 perforations with 5 millimeters between. Lateral incisors, also plus 5 millimeters. Increase the diameter of your puncture. Very carefully, canines. Plus 5 millimeters. The same hole, plus 5 millimeters. Premolars. Symmetrically from both sides. check that your holes distribute equal above your selected tooth. Very good. And we start to fix our clamps. I think that we can repeat all stages because you must remember what we made during this lesson. So the next stage, testing interdental spaces and testing clamp stability. Don't forget to check all interdental spaces. And also check clamp stability at the selected tooth of your patient. If you think that you waste time on this stage, you waste your time when you lose stability inside your mouth and make trauma to your patient. This is not good. So check every time stability of clamps. Oh, it's slightly moved. It's not stable in this variant. Find the more stable. Very good. Previously, we stretch our rubber dam over the frame, over the arc of clamp. Now we fix our clamp inside the rubber dam perforation. It's very easy. Hold your clamp like a ring, stretch your hole, and put the body of your clamp inside this hole. Repeat it with the other clamp. The difference between clamp with wings and wingless, very easy to understand. Clamp with wings, it's easy to fixation. Clamp without wings is more difficult to work, but it's more comfortable for during your dental work because it's more compact. And I decided to use this variant only clamp without wings. Fix both of them. In this variant, you always must full detach your rubber dam from frame. Find the perforations for clamp pillars on your clamps and fix one clamp pillar and slightly stretch the stopper. Then find the tooth you want to isolate. It's very easy because you watch for all tooths. We can use from the left side, no matter, or from the right side if it's comfortable for you. Then find the next clamp, fix it. In the patient, I made it in front of the incisors, not inner, inside. Made it outside, and then place to the premolar. 35. Very good. When you have two clamps, it's no question what is the angle of your rubber dam, left or right. It's easy to understand, and you must fix your rubber dam plate to metal frame or plastic frame, no matter. Very good. In this variant, we have already covered the tooth number. We already covered with rubber dam the tooth number 36, 46. We just need to release rubber dam from clamp. I use the sharp therapeutic probe. It's very good for work in this stage. It's comfortable, it's useful, it's fast. And you don't need special instruments to this stage. Then the last stage of this work is the inversion of rubber dam. Distribute the holes equally, because if you invert two rubber dam perforations in one interdental space, this is error. You did not have enough perforations to invert all tooth, isolate all tooth. So check that you have only one perforations in one interdental space. I think it's better to work with the floss. If your patient have open or wide interdental spaces, you can use only your fingers. But in my variant plastic model from MedSkills, I have very straight contacts in interdental spaces. So I use only floss. Carefully work. Don't make trauma to your patient gingiva. I remove all flosses directly outside lateral. It's fast, but if you need more time in clinic, don't hurry. I think this is good for therapeutic work, for contacts, for incisors, for fissures in premolars. It's very good working place. If you decide to have additional work in cervical area, please add a special clamp. This is not a clamp, this is a gingival retractor from the Brinker. Small tense of rubber dam with your instruments, finger or help of your assistant, and place Brinker. Very often I work with 2 or even 3 Brinkers at once. This is very good, but this is not. So replace it to have a correct position of clamp. Don't cut the rubber dam plate with your Brinker. This is very good. We finish our exercises to making an envelope around our clamps as usually. Made in your work to have a good isolation of water. Invert, slightly tense down and cover with the free angle of rubber dam. Hold it inside with your fingers, release your finger and make it cover with the inner part of rubber dam. Very good. I check that we have enough space to cover the tooth of upper jaw. Very good. This is a good variant to work. We have enough space. We have a special fixation in cervical area with Brinker retractors. And now remove our isolation system. First remove the Brinkers, gingival retractors. Then I think it's more easier in your clinical application. Detach envelope and free your rubber dam to see what's happened. Then take your scissors, tense your rubber dam and start to cut very gently and carefully this interdental part of our rubber dam. It's very good, very careful, very hygienic way to remove rubber dam. Cut all incidental parts, then remove your clamps, and now you can very easy detach the rubber dam from your tooth. So colleagues, thank you for your attention. I hope you like this exercise. If you have any questions, please write it in the comments below. Don't forget to like this video and share it with your colleagues and friends. Thank you. Goodbye.